Hello everyone, I'm Pharmacist Michael, and today I'm going to talk to you about Lyme disease. And I want to let you know that I got this topic from one of my TikTok followers during one of my live broadcasts over the weekend. So if you are interested in any health and wellness topic at all, please let me know in the comments and I will do a video for you. Lyme disease is spread to humans through the bite of infected black-legged ticks. Symptoms include fever, headache, fatigue, and a skin rash, which often appears in a bullseye pattern. The risk factors of Lyme disease are where you live, where you vacation, what your profession is, and what kind of outdoor activities you enjoy. The most common risk factors are spending time in wooded or grassy areas in the United States. Deer ticks are found mostly in heavily wooded areas of the Northeast and Midwest. Kids that spend a lot of time outdoors in these regions are especially at risk. Adults with outdoor jobs are also at an increased risk. Having exposed skin is also a risk. Ticks attach easily to bare flesh. If you're in an area where ticks are common, protect yourself and your children by wearing long sleeves and long pants. And don't allow your pets to go into high grassy areas. Now I know that's hard to do, guys. It's pretty hard to keep a dog from running around in the woods and in the grass, right? Another risk factor is not removing ticks that are attached to you quickly or not doing it correctly. Bacteria from a tick bite can enter your bloodstream if the tick stays attached to you for 36 to 48 hours or longer. If you remove the tick within those 2 days, your risk of getting Lyme disease is a whole lot lower. How do we treat Lyme disease? Well, we use antibiotics. These are the standard treatment for early stage Lyme disease. We usually use doxycycline for adults and children older than 8, or amoxicillin or cefuroxime for adults, younger children, and pregnant or breastfeeding women. A 14 to 21 day course of antibiotics is usually recommended, but some studies suggest that courses lasting 10 to 14 days are equally effective. If the disease involves the central nervous system, your doctor may recommend treatment with an IV antibiotic for 14 to 28 days. This is usually effective in eliminating infection, although it may take you some time to recover from your symptoms. IV antibiotics can cause various side effects, including a low white blood cell count, diarrhea, or an infection with other antibiotic-resistant organisms that are unrelated to Lyme disease. If you don't treat the Lyme disease, you may experience a whole host of problems. Chronic joint inflammation. We call this Lyme arthritis, and usually it happens in your knees. Facial paralysis or neuropathy, and cognitive effects such as impaired memory. You may also experience heart rhythm abnormalities, and we know that most cases of Lyme disease can be cured within the 2 to 4 week course of antibiotics. But in about 10 to 20% of cases, patients develop a more severe disease, and these symptoms can be debilitating. Things such as pain, fatigue, headaches, mental fog, which causes difficulty in remembering or word-finding difficulties and inability to sleep. This condition is called post-treatment Lyme disease syndrome, or PTLDS. This is a big problem with Lyme disease. And since the incidence of Lyme disease is going up, patients suffering with PTLDS is also on the rise. The problem is there's no current clinical treatment guidelines that specifically address PTLDS. You might be thinking, why not just increase the length of the antibiotic therapy in these patients? The answer to this question isn't simple. First, there have been case reports of patients having some pretty significant side effects from long-term antibiotic use. Rash, diarrhea, allergic reaction, and C. diff infections are just a few. Secondly, we aren't sure whether long-term antibiotic use is even effective for PTLDS. Are there other options? Disulfiram has been tried. This drug, also known as Antabuse, has traditionally been used to keep people from drinking ethanol. If you drink alcohol while taking Antabuse, you become sick. And judges have ordered alcoholics to take daily doses of Antabuse for this reason. Disulfiram was used in France on a few patients, but over 80% of those subjects reported side effects, and it is unknown whether it actually helped with the PTLDS symptoms. A case study of the use of ketamine for pain resulting from PTLDS has also been reported. This patient was happy with the results of the ketamine for her pain, but it's important to mention that traditional pain medications had not been effective for her. Another option is to use resistance exercise training. There have been positive results reported from resistance training, but more studies need to be performed. The bottom line is we need to have a protocol for treating patients with post-treatment Lyme disease syndrome. As the number of patients with this condition rise, I hope to see more answers as to what therapies are the most beneficial. Until then, I recommend seeking out a Lyme disease specialist if you suffer from PTLDS. This is likely your best option at the present time. Please always remember, when it comes to diseases such as PTLDS, it's always best to find someone who does nothing but that, right? Because they've seen a lot more cases and they're going to have better ideas of what to use to help you get through your ailment. If you've enjoyed this video, please give it a thumbs up. If you know of anybody else who may have Lyme disease or may be interested in this subject, please send this video to them. If you have any subjects you would like for me to cover having to do with health and wellness, please leave a comment on this video and I will begin working on it. Please subscribe to this channel for more happy, healthy information. My name is Pharmacist Michael. Please be happy and be healthy.